It's been almost 3 years since Granite Staters heard that COVID was here, and then life changed very, very rapidly. Schools went remote, businesses changed their operations, meetings became virtual, and hospitals became overwhelmed. We lost friends and families to a virus. And over that time, we have learned so much about facing adversity as medical professionals learned about the public health crises we were facing and our infrastructure. Here to talk about what we learned and what the realities are today about living with COVID is state epidemiologist Dr. Benjamin Chan. Doctor, thanks for joining us here this Sunday.
Good morning. Great to be here. Thank you.
So here we are almost 3 years later to the day. Where are we right now when it comes to the coronavirus?
Yeah, and it's hard to believe that it has been almost 3 years since the first case of COVID-19 was identified in New Hampshire. It's been a long 3 years for many people. But, you know, I think we've made great strides, particularly over the last year since last winter's Omicron surge, in trying to help people get back to normal life, normal operations. And I think we've been largely successful at that over the last months to year, and that's thanks in large part to the availability of the COVID-19 vaccines, the COVID-19 therapeutics or medications to treat COVID-19. But I think people still need to have a balanced perspective or a balanced view on what's going on with COVID-19, right? We don't want people to ignore that COVID-19 exists. COVID-19 is still circulating. It's still causing hospitalizations. It's still causing people to die from their infection. But at the same time, we don't want people to live in fear of COVID-19. We want to help people feel comfortable getting out, re-engaging, not isolating as much. And so, you know, where we are now, I think, is that COVID-19 continues to circulate. We see numbers go up and down. We see hospitalizations and death numbers, mortality figures go up and down. But in large part, we're relying on the tools we have, like vaccines and medications, to try and limit the severity of COVID-19 and limit the impact that it has on our daily lives and on our healthcare system.
And in many ways, that has now happened where
yes,
by and large, we can view this very differently than we were 3 years ago.
That's right. We're no longer in the emergency phase of responding to COVID-19. COVID-19 is still out there. The WHO, the World Health Organization, still has a pandemic declared for COVID-19. But we're in a very different spot now in New Hampshire and in the United States than where we were, you know, almost 3 years ago now, when we were still learning about this very new virus. There's a lot we know about COVID-19 now, and we know how to control it, and we have the tools at our disposal to do that.
And now, as we look at kind of where COVID is at this point in time, when we look at who is dying from COVID, it's almost all folks 75 and older, according to the White House COVID response coordinator. But there's still 400 to 500 deaths every single day in this country. So it's still a high number of deaths, but much lower than where we were several years ago. Yeah,
and I'll say that New Hampshire has tracked COVID-19 related deaths consistently all throughout the pandemic. So people can go onto our COVID-19 website and look at some of the COVID-19 related death numbers specific to New Hampshire. And those numbers are comparable across the last 3 years of the pandemic. And what I can say is that numbers are definitely lower than they were in the last few years, but we're still seeing on average 1, maybe 2 people dying per day from COVID-19 in New Hampshire. And that amounts to, you know, maybe a couple of dozen people per week dying from their infection. So it's still causing, you know, a significant number of people being hospitalized, a significant number of deaths, but not anywhere near the levels that we were seeing during some of the past surges of the pandemic.
So, Dr. Chan, what are the recommendations right now, by and large, for most folks watching this when it comes to what they should be doing every day when it comes to trying to go about their lives, but also dealing with COVID?
Yeah, so as we say with other diseases that we have vaccines for, like flu, the first line of defense, or one of the most important lines of defense against COVID, is vaccination. We have an updated COVID-19 booster shot that is available. It became available back in September. And so the first line of defense continues to be getting vaccinated and making sure that people are fully up to date and have gotten all vaccines that are recommended. You know, and then there are common sense measures that people can take to protect themselves from COVID-19, in addition to many other types of respiratory diseases. And these are the types of recommendations that people get tired of hearing public health talk about, but, you know, washing your hands, covering your coughs and sneezes, staying home when you're sick, those continue to be recommended and important steps that people take to limit the spread of any number of infectious diseases. We do still recommend that people test if they have symptoms so that they can know if they have COVID-19 or not, and that's important for a couple of reasons. reasons. One is because if somebody tests positive, they can take steps to prevent spreading it to other people. But it also becomes important for somebody to know if they have become infected with the COVID-19 virus, because there are medications out there that could help limit the severity of disease and the duration of symptoms. And that's sort of the last line of defense if somebody has COVID-19, particularly if they're older, if they have chronic medical conditions which put them at higher risk for more severe complications from infection. They can call their healthcare provider and be prescribed a medication to limit the duration and the severity of symptoms.
And that leads me right to my next question, which was about the one we hear about the most, Paxlovid. So who, in your view, should be getting it? And is that a tool that's being underutilized, do you think, when it comes to treating COVID?
Yeah, so we've definitely heard that Paxlovid is being underutilized. We have done a lot of messaging around the importance of some of these medications to treat COVID-19 when somebody develops infection, and they remain widely available in the state. We recommend that people first check with their primary care provider to see if the primary care provider thinks that the person is appropriate for the medication and to prescribe it. But if a primary care provider, for whatever reason, isn't reachable or maybe isn't familiar with the medication or has concerns about it, there are other ways that people can seek out care. There are, test to treat locations around the state. There is a contract with On-Site Medical to provide free telehealth services. Any urgent care can take walk-ins and assess somebody for Paxlovid or other medications. But the first go-to medication for treating COVID-19 really is Paxlovid. If somebody's not appropriate for that, there are some other options, but the preference is for people to get Paxlovid.
And earlier in the pandemic, we also had the monoclonal antibodies, but as these other variants been coming out, we've kind of had a smaller and smaller arsenal of tools. Does it concern you that we're down to kind of just one antiviral or in some cases two antivirals for COVID, and we're one mutation away to being down to zero in some ways?
Yeah, so the current antiviral medications that we have, there's actually three of them. There's Paxlovid, which is a pill that people can take. There's an intravenous medication called Remdesivir, and then there's another pill called Molnupiravir, which can all be prescribed. And those antivirus medications are all still effective against the current variants that are out there causing infection. But you're right, we've seen over the course of the pandemic that some of the other therapeutics, what we call the monoclonal antibodies, as the variants have emerged, they have become resistant to these monoclonal antibodies. And so those therapies, those monoclonal antibodies, were critically important, particularly in the earlier phases of response. They quickly became available. But they become more difficult to implement as a long-term strategy because we've seen the variants emerge that gain resistance to that type of therapy. But we do have these other pills, these other intravenous medications, which have consistently remained effective at treating infections throughout the pandemic since they've become available.
And so now that we are at this point in COVID, how is the public health system holding up? Is it still looking like it did maybe 6-8 months ago, or are things starting to settle down in some ways in that regard?
Yeah, so certainly the emergency response, the urgency of response has settled down. But there's a lot of discussions happening and a lot of work to be done about how to improve the public health system and the public health response for future pandemics. And I'm not talking here specifically about New Hampshire's response. I'm talking about the national public health system response as a whole, and the coordination and communication that happens between various branches of the federal government and between the federal government and state governments and between state governments and local governments. Anytime there's an issue like we saw, of the magnitude like we saw with the pandemic, it calls for a huge response, a lot of coordination, a lot of communication. And I think what we've seen is that there are ways to do that better. And I think we're in the phase now of trying to look at areas that can be improved, improve the coordination, improve the communication, and that also involves improving how we collect and share data. That's a huge topic nationally, something called the Data Modernization Initiative, or DMI as it's referred to, is an area of increasing focus because what we found during the pandemic is that it's hard to get the pieces of data that we want and need to the people and the organizations that need them in a timely fashion. And a lot of that has to do with interconnected data systems and the ability to send data. So, the other large issue here is one of workforce, right? We've seen the healthcare system, we've seen the public health system really struggle with the workforce and burnout. So I think we're going into a phase of needing to rebuild staffing and personnel within our healthcare and public health system, work on improving data flow and communication between data systems, and then improving just the general coordination and communication that we have between the different areas of communities and government and federal versus state government.
So in your view, at the end of the day, do we come out of COVID and the lessons learned stronger for the next response because of what we've been through?
That's the hope and that's the plan. And there are a lot of different discussions occurring amongst different groups about how to respond more appropriately in the future. With that said, though, I do want to highlight that there are some huge successes in the pandemic response. Have to give a shout out and a thanks to the thousands of healthcare workers, the thousands of public health professionals in New Hampshire and across the country who did overtime during the pandemic responding to the crisis, and the immense amount of work that was put in, the very quick rollout of highly effective, safe vaccines was crucial for trying to wind down the emergency phase of the pandemic. There's ongoing testing and case investigation, responding to outbreaks. All that work is continuing, although there is a lower urgency than there was earlier in the pandemic.
Well, Dr. Benjamin Chen, we appreciate your time this Sunday. Thanks for joining us.
My pleasure. Thank you. Happy to be here.
Thanks.